Hello and welcome. This is NAFDAC and Your Health, the TV program that brings you updates on the activities of NAFDAC, the agency that is in charge of safeguarding the health of the nation. I am your host, Amanda Ugo.
Today on NAFDAC and Your Health, we begin by exploring what antimicrobial resistance is, colossal danger it poses to public health, and why efforts should be made to eradicate it. Then we'll go on to showcase highlights from the 2023 edition of the World Antimicrobial Week as commemorated by NAFDAC. Then in the second segment, we'll be featuring the 2023 edition of the Poultry Show, where NAFDAC gave a regulatory perspective to issues in addition to sensitizing the stakeholders on the vision and mission of the VMAP Directorate. One of the major challenges bedeviling public health and has taxed NAFDAC as a regulatory body controlling the administration of food and drugs in Nigeria is antimicrobial resistance. This phenomenon is one that has been on the increase, exposing the public to great danger by the day.
A livestock is not supposed to be fed with medicine unless there's a disease. And that disease has to be monitored, or the treatment has to be monitored. But in a situation where you indiscriminately add that to their feed, it affects us. Antibiotics, for example. When a livestock or animal, whatever, is fed antibiotics indiscriminately, we take the antibiotics when we eat. And before you know it, we may be building resistance. Because you take a little bit, maybe you take 1/20th of what you are supposed to take if you are really sick, but the 1/20th is coming from the meat. And I keep taking it, the 1/20th is not going to kill any microbes. Before you know it, the microbes will start building proteins around themselves because it's not killing them, so they want to also build a coat around themselves. That is how human beings develop antimicrobial resistance. Antimicrobial resistance is doing a lot of damage worldwide, because what happens then is the doctor now gives you a medicine, an antibiotics for a particular disease, ailment, and it doesn't work. Because the microbes have built a coat around themselves, they've developed resistance against that medicine.
Owing to enormity of the havoc antimicrobial resistance is capable of causing, it behooves on NAFDAC to key into the efforts geared towards nipping the menace of antimicrobial resistance in the bud. The Directorate of Veterinary Medicine and Allied Products, which is the directorate within whose purview the responsibility falls, has been up to the challenge, working frantically in collaboration with other directorates and relevant stakeholders to fight antimicrobial resistance. Part of this effort is the commemoration of the annual World Antimicrobial Week. This event, marking this year's commemoration, which was themed Preventing Antimicrobial Resistance Together, was held between the 20th and 21st of November 2023 at the NAFDAC office complex, Isolo, Lagos. It was aimed at building effective stewardship of antimicrobial use, especially antibiotics. In her opening address, the Director General of NAFDAC further expatiated on the weighty efforts of antimicrobial resistance on global health, its negative effects, and the defiance it causes to most existing drugs.
I'm an example of antimicrobial resistance due to abuse of antibiotics when I was a teenager. I became very, very ill. And I was sick unto death. I was rushed to Adeoyo Hospital in Ibadan, and there was no antibiotic that could take care of me. My body temperature, they had to be pouring ice chips on me with a Macintosh under me, on the bed. So I know what it means to abuse medicines. Those days I was a teenager, I thought I could just use half the dose and whatnot, the regimen, and that would be it. But I almost lost my life. New antibacterial, which is very expensive to develop, are urgently needed But if people do not change the way antibiotics are used now, these new antibiotics will suffer the same fate as the current ones and become ineffective eventually. My experience taught me on how to use medicine responsibly. In fact, I don't like using medicines now, but I know how not to abuse it. Misuse and overuse of antimicrobials are the main drivers in the development of drug-resistant pathogens. Lack of awareness and knowledge, poor enforcement of legislation contributes hugely to antimicrobial resistance. These pivot points are what we are virtually gathered here today to jointly address. When adequate knowledge and the awareness on the looming danger is clear to all, the handling and use of antibiotics in livestock husbandry, plants, and human health will be science-based towards reduction in the use of antibiotics where alternatives are available. As antimicrobial resistant organisms are found in people, animals, food, plants, and the environment, battling AMR becomes a multi-sectoral transdisciplinary effort, a paradigm for joint action mirrored on the global stage by the then tripartite of the Food and Agriculture Organization FAO of the United Nations, the World Organization for Animal Health (WOA), and the World Health Organization (WHO). Now, quadripartite organizations with the newest involvement of the United Nations Environmental Program (UNEP). That is why in NAFDAC, if you see the program, it is not veterinary medicine allied products only. It is drug registration, where we do all our registration, including antibiotics. It is pharmacovigilance, because AMR is a serious side effect. It is a serious adverse effect following misuse or abuse of medicine.
Speaking earlier in her welcome address, the Director of the Veterinary Medicine and Allied Products Directorate, Dr. Ramatu Mumodu, described antimicrobial resistance as a significant battle that needs to be fought squarely.
The quadripartite, the World Health Organization, Food and Agriculture Organization of the United Nations, FAO, United Nations Environment Program, UNEP, and the World Organization for Animal Health, WOA, has declared 18th to the 24th of November 2023 to celebrate with the theme Preventing Antimicrobial Resistance Together. NAFDAC, through the stewardship of our esteemed Director General, Professor Christiana Mojisola Adeyeye, has adopted the One Health concept, which is a collaborative, multi-sectoral and transdisciplinary approach to work at the local, regional, and national and global level with the aim of achieving optimal health outcomes, recognizing the interconnection between people, animal, plants, and their shared environment. NAFDAC is executing its mandate through the One Health approach to safeguard the health of the nation and save lives. The Veterinary Medicine and Allied Products Directorate is the agency's desk on One Health and antimicrobial resistance. The Directorate engages with other directorates and relevant stakeholders to mitigate antimicrobial resistance. NAFDAC has put in place regulatory measures to curb the emergence and spread of antimicrobial resistance. These measures are important to ensure food safety, food security, a safe environment, and healthy citizens of our dear country. It is our prayer that with this awareness training of stakeholders and staff, there will be a drastic reduction in the emergence of antimicrobial resistance, and that we all from today are good ambassadors of the antimicrobial resistance.
The two-day event was a form of training for the staff of NAFDAC and the stakeholders in attendance. On the first day, 3 presentations were made by resource persons in succession. Dr. Benedict Hutter from the WHO headquarters in Geneva opened the floor with a presentation titled The Aware Antibiotic Book, What It Is and How to Use It. This was followed by another presentation by Mr. Washington Dengu, a pharmacist and consultant with the WHO, on the topic Mainstreaming of AMS and AMR awareness into medical products regulatory system. Dr. Jennifer Cohn, Director, Global Access at the Global Antibiotics Research and Development, wrapped the day's presentation up with her own presentation titled Responsible Access to Antimicrobial Agents, a Case Study of Antibiotics. The event continued on the second day with a presentation by Dr. Ayodele Majekodumi, Country Projects Manager and one-time health epidemiologist, on the topic Managing Infection Successfully and Strengthening the Nation's Health System. Her presentation was followed by that of Professor Aaron Aboderi of Obafemi Awolowo Teaching Hospital, Ile-Ife, whose presentation was on the role of relevant stakeholders in the implementation of National Action Plan.
Resistance has been a problem. In fact, this whole issue about antimicrobial stewardship has been around for as long as there's been antimicrobials. So immediately following World War II, with the very first development of antimicrobials, we recognized the importance of taking care of the use of those antimicrobials because indiscriminate use might be wasteful or harmful to the animal population. So
it is hoped that the training for NAFDAC staff and stakeholders will bring about drastic reduction in the emergence of antimicrobial resistance, and the participants will become ambassadors of the fight against antimicrobial resistance, and then together, everyone can prevent the menace.
NAFDAC and Your Health has more for you after the short break. Please don't go away.
NAFDAC has observed with dismay the wanton illegality of unlicensed vendors peddling drugs to unsuspecting members of the public, despite efforts aimed at tackling the menace of drug hawking. NAFDAC hereby advises the general public to desist from buying drugs from these merchants of death. Drugs sold by hawkers are fake, counterfeit, and substandard. The hawkers expose the drugs to inclement weather, which degrades their active ingredients since they are stored in conditions that render drugs poisonous. The drugs could therefore damage the liver and kidney or lead to the death of the consumer. Drug hawkers constitute a threat to our national security. Hawking of drug is one of the main causes of drug abuse, as victims continue to fetch drugs from unregistered and unregulated hawkers. Consequently, drug abusers soon succumb to the dilemma of depression, personality disorders, suicidal thoughts, mental disorder, sleep problems, organ failure, damaged immune system, memory loss, anxiety, social and economic problems. NAFDAC hereby warns those involved in the nefarious act of hawking drugs to desist from this illegal act or face the wrath of the law. NAFDAC, safeguarding the health of the nation.
Thank you for staying tuned. You are still watching NAFDAC and Your Health.
The Directorate of Veterinary Medicine and Allied Products of NAFDAC, in furtherance of its sensitization initiatives, was recently at the 2023 Poultry Show organized by stakeholders in the poultry and livestock industry generally. The show, which had in attendance relevant stakeholders and players in the industry, was an avenue for the stakeholders to discuss the challenges facing the industry with the aim of preferring solutions and eliminating the challenges. The theme of this year's edition was Challenges of the Poultry Industry, Current Perspectives, the Role of the Government and the Private Sector. NAFDAC, as the regulator of the industry, was also there to talk from the regulatory perspective. Speaking at the event, the director of the VMAP Directorate of NAFDAC, Dr. Ramatu Momodu, said NAFDAC is ever ready to bridge the gap between the industry and the regulator.
We are here to bridge the gap between the industry and the regulators. And it is our hope that at the end of this, you will go away with a better understanding of what we do and why we'll do it.
The director of VMAP Directorate also stated the vision and the mission of the VMAP Directorate.
The mission of the Directorate is to protect human and animal health by ensuring that only safe, effective veterinary medicine and allied products are available for use in Nigeria, and the vision is to safeguard the health of the nation through One Health approach. VMAP as a directorate is structured into 4 divisions, with the animal field and premix division dedicated to animal nutrition regulation at the national level. This division is AFPD, and the regulatory activities covers animal feed, medicated feed, pet food, animal feed additives, supplements, and premixes, just like the one we have just listened to. So part of our activities, so the powers that we have enables us to regulate animal feeds, veterinary drugs, cosmetics, and chemicals used in animal production. We regulate animal feedstuff, like we're doing today, part of our activities. The feedstuff is done to assure that production of what we do is to assure that the feed is safe for consumption by the animals, and especially food of animal origin such as eggs, meats, like we have heard today, milk and milk products. And under my leadership, I promise that I would have an open door policy. We would do things with a science-based approach, and we would go into collaboration, not collaboration, because we're already into collaboration like this one. And thank you, sir, for facilitating this. And we're open to collaborations and cooperation with all stakeholders. I know that there is an issue that is on ground and that breeds a lot of passion, which is the regulation of premix. I have been briefed on this, and the regulation of animal premix is being reviewed, especially the imported premix, and we will look into this and see how it is implemented so that everyone will be well taken care of. I want to sincerely appreciate everyone who is here, appreciate the organization that puts this together, and we are open to cooperation. We want more cooperation from you, more collaboration, and to help us as we do our work, because we can't do this regulation without you, we can't do the control without you, and we look forward to more opportunities to have this engagement.
Dr. Ramatu also emphasized the readiness and commitment of the VMAP Directorate to operate an open-door policy with the players in the industry. Dr. Tunde Sigbeku, the head of Animal Feed and Premix Division of the VMAP Directorate, seized the opportunity to sensitize the gathering on the right way to feed livestock.
Meat and bone meal is just a product from animal processing, which is a byproduct. And feeding of meat and bone meal to cattle is not allowed. That I want to emphasize from regulatory point of view. And all my veterinarians in the house will be a witness to this, and they will agree with me that you don't feed animal source to ruminants, be it cattle, sheep, or goat. Personally, from my own exposure, I would discourage your feeding it to rabbits because they are pseudo-ruminants. Not that I'm having any justification to say that meat and bone has caused problem in a rabbit, but I just felt being a pseudo-ruminant, let's leave that down. But for the huge industry we have in Nigeria, Nigeria is having over 400 million poultry birds. And that as at January 2022, I believe it must be more than that now. And an average of 2 kg is needed for every broiler bird from day old to slaughter. And when you look at the number of broiler we have, translate with the expected intake of feed, then look at the volume of feed that we need in poultry production. With that, let's consider our effort in using MBM for poultry nutrition and for swine. Let me say this, it's disheartening to note that many of us that are piggery farmers, swine farmers in the country, we rely on feeding junks to our animals, swine, pigs. We rely on feeding junks to them.
Also present at the show was the Managing Director of Agromerit Nigeria Limited, exporters and distributors of major raw materials for the animal feed industry, who stressed the significance of establishing partnership with customers and being solution providers.
The easiest business to do, as far as I'm concerned, is the agro-related business. Very simple. But people turned it to something else. We have NAFDAC today. There are many people that are running away from NAFDAC, right? Yeah. It's a sign that we are working in line with the law, what their regulation stipulates. We will never go contrary to that.
Evidently, the mission of the VMAP Directorate to sensitize the stakeholders and intimate them about the need to see themselves as partners to NAFDAC was achieved.
Great farmers, great nation. No farmers, no nation.
Director of the Southeast Zone of NAFDAC, pharmacist Martin Seluyomade, has sounded a note of warning to manufacturers and sellers of food products, cosmetics, drugs, medical devices and other regulated products to desist from obstructing officials of the agency from carrying out their inspection as they are empowered by the law to do so. The Zonal Director gave the warning at the stakeholders' engagement in Enugu recently. According to him, NAFDAC officials are empowered by the Food and Drug Act to enter premises for inspection without warrant. He added that whoever is found to have contravened the law is liable to conviction, and that unregistered products and proceeds made from the sale of such products will be forfeited to the federal government. Pharmacist Seluyomade had earlier paid a courtesy visit to the Commissioner of Police, Enugu State Command, to seek the cooperation of the police and synergies with NAFDAC's sister agencies for a smooth working relationship in the state. That was NAFDAC Update. You have been updated.
Thank you for watching this edition of NAFDAC and Your Health. We promise to bring you another informative edition, same time, same station, next week. If you have any complaints, questions, please reach out to us and we'll be ready to interact with you.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Remember, it is unlawful to import, produce, distribute, market, or sell unwholesome food products, drugs, chemicals, and medical equipment. Do not be part of any of these crimes because they pose great danger to the public health. Till we meet again next week, bye for now.